Hi, everybody. This is a conversation for Willamette Week's endorsement of Measure 108. Measure 108 would increase taxes on tobacco products and vaping products. Could someone from Team Yes on 108 give us a quick walkthrough of how much this would raise tobacco taxes and how much money that would raise, and then give us a brief argument for passing this measure?
So I'll go ahead and answer very quickly. Christina Bodamer, our Oregon Government Relations Director from the American Heart Association, the first question that you posed, and then I'll hand it over to Bianca to talk a little bit about what's at stake. The estimates of what this will raise for the current biennium is around $111 million. And that goes up to around $333 million in the next biennium in terms of just new revenue. And Bianca, I'll kick it over to you.
Hi, thank you for inviting us. My name is Bianca Gherghe, and I am a senior this year at Westview High School. And when I entered high school 4 years ago, the popularity of vaping was undeniable. With these devices being inconspicuous as they're small and easy to hide, and they lack that typical harsh chemical smell, I've seen students take a hit in the classroom behind laptop screens or in hoodies, or groups of students crowded in bathroom stalls vaping together. And I think that there's an immense pressure to vape, both from peers and from the companies that sell these products. When I was in middle school just 4 or 5 years ago, vaping was never an issue, and now it's becoming increasingly prevalent in many middle schools, where these kids are as young as 12 years old, and these receptive young students aren't recognizing the danger that's associated with these products. And I've seen the addictive nature both of cigarettes and of these vaping devices firsthand, both in my family in Romania, where by the age of 15, many people are daily smokers, and I've seen the destructive health effects of smoking in close family members. And I've also seen the addictive nature of these vaping products in close friends and peers who started vaping when they entered high school, and now just a few years later, or even a few months later, they were running out of class, a 90-minute class period, or out of a basketball game lasting a couple hours because they couldn't stay that long without having nicotine in their system and taking a hit of their vape. And the low cost of these products, especially with vapes not being taxed at all in Oregon, and some of the lowest tobacco taxes across the country, it makes the peer pressure extremely hard to resist. So when something that's routinely purchased can now increase in price through a tax, consumers are going to second guess their decision to continue purchasing a product that's only fueling an addiction. And with the more that they buy, the more reliant that they become on these products, which only leads to increased spending down the line. So by increasing this cost of these products through a tax, it'll make individuals more likely to quit vaping and smoking and less likely to even begin. And it will also provide more prevention and cessation dollars back to continue the fight against the tobacco industry. So for these reasons and more, I'm hoping you will endorse Measure 108, and we look forward to continue discussing this measure with you all.
So thanks, Bianca. Christina, could you go back? So you're talking about $165 million a year in the next biennium. Could you break that down as to how much is going to be cigarette, how much is going to be vaping, how much is going to be cigar?
I don't actually have those exact numbers of that breakdown in terms of what the allocation is from each of the different products, but I can explain what the allocation of the revenue will go to. It is 90% towards the Oregon Health Plan, Oregon's Medicaid program, and 10% to tobacco prevention and cessation efforts. And I will mention that that number would more than triple our investment in tobacco prevention and cessation efforts in the state of Oregon.
So in the voters pamphlet, there's a sentence that caught my attention. It says the current cigarette tax and proposed tax are dedicated to different purposes. So what's the current cigarette tax money going to? Can you remind me of that?
So the mix of where the current allocation of the current cigarette tax is, a good chunk of it goes to the Oregon Health Plan. There are other parts that go to different transportation measures. It is actually broken up into 2 different statutes from different times when we passed a new increase in tobacco taxes, which it has been almost 2 decades of where that dollar goes. So it's not quite as clear for me to tell you exactly where the existing allocation is on where the new allocation, because it's overlapping statutes, but I can definitely follow up and get you that allocation.
Okay, so The question, I think one of the questions we always have with the new tax is what's to stop the legislature from just basically whacking the OHA budget and saying, okay, you're getting all this new money from this new cigarette and vaping and cigar tax, so we're going to cut you by a commensurate amount. So what's to stop the legislature from just backfilling?
I think that we were very mindful and when we were creating the language of the policy to make sure that the investments were going back to where they would be most beneficial, and that is the Oregon Health Plan, who will use this money to actually stabilize their funding for the next several years to make sure that the growing population of Medicaid in Oregon, currently it's 1 in 4 Oregonians get their health insurance from the Oregon Health Plan.
That sounds great, but I'm asking you what's to stop the legislature from cutting the OHA budget by the same amount that this tax increases it?
Advocates will prevent that from happening, and the language in the bill is very clear on what the allocation will go to. We often hear that the money will get dumped somewhere else, and we've seen in cases of like Measure 101 that the money goes to where we say it will, and the language in this is explicit of where it should be going.
Okay, great. Well, let's ask your opponents, the people who do not want this measure to pass, to introduce themselves and to briefly provide a case for why we should vote no, or why we should endorse a no vote. And please introduce yourself, tell us who you represent.
Do you want to go first, Greg?
You go right ahead.
Okay. My name is Jason Weber. I own Smokeless Solutions and Vape Crusaders. I'm sorry?
Where are those shops located?
Roseburg, Oregon.
Right.
So, I mean, my biggest concern is that it will put 90% of us out of business because 65% is a big number. And then you add the fact that there's internet sales. So that's kind of a scary factor for me and my customers. And most of my customers are over the age of 35 and most of them are of the low income. So I guess that would be my top concern over everything.
Are internet sales legal?
Yes.
They are legal. So you're competing with internet sellers already.
Yes, sir.
But then you would be competing with internet sellers who didn't have to pay this new tax.
Yes, sir.
How long have you been in business?
A little over 6 years.
You a vapor yourself?
Yes, sir. Quit smoking with it. It's been 9 years since I've had a cigarette.
Okay. All right. Others on the no side?
My name is Gregory Conley. Thanks for having me. And I run a nonprofit, national in nature, called the American Vaping Association. I got into this work about 10 years ago when I was in law school, quit smoking with a vaping product after years of trying and failing to quit smoking. And with those who were pushing this measure, no mention was made of the adult smokers that are still in the state of Oregon, 500,000 plus of them. And we know from the Royal College of Physicians, Public Health England, multiple health groups, including former FDA Commissioner Scott Gottlieb, that if an adult smoker switches to vaping, all of the evidence suggests rapid health improvements that matter for public health. Public health is about reducing disease and death. It's not about an ideology that says anything involving nicotine must be bad. We need to do more to reduce youth usage. We already found that in 2020, before the pandemic sent kids home, vaping by high schoolers, according to the 2020 National Youth Tobacco Survey, dropped by 1/3. And in middle schoolers, it dropped by 1/2. So with Tobacco 21 coming into effect at the beginning of the year, and certain products like Juul being forced to take their flavored pods off the market, while open systems, the products sold at vape shops, they could still continue to sell flavors, we saw a big drop. And there's also some hypocrisy at work in this, where the devices sold in Jason's shop, if they are marketed for use with nicotine, it's going to be a 65% wholesale tax. Meanwhile, if they're marketed for use with marijuana, they're exempt from this new tax. So you're going to have people in smoke shops slapping labels onto products saying they're for marijuana. Meanwhile, the shops that are marketing directly to adult smokers, they're not going to be able to pull that trick, and they're going to get hit because of this.
Great, thank you.
Thank you.
I want to come back to the proponents for a second. One of the criticisms I don't think either of these gentlemen made, but we hear frequently when cigarette or vaping taxes are discussed, is the issue of regressivity. People who smoke or use vapes are disproportionately low income. This will hurt them the most. So talk to us about that, please.
That's a great question. Thank you. You know, I want to talk about the importance
I'm sorry,
of.
could you introduce yourself, please?
Yeah, my name is William Miller. I serve as the Advocacy Manager at the Native American Youth and Family Center. And in fact, the Native American Youth and Family Center has chosen to endorse this measure for many reasons. The communities that we serve are predominantly low-income people of color, and it's really important that we continue to think about upstream public health solutions, and this is one of those ways. The impacts of tobacco are affecting the social determinants of health in many, many areas in our community, in my own family. And I know firsthand that if we're able to implement this and it passes, when it passes in November, those in my community and those that I love and serve every day will have the opportunity to live a healthier lifestyle.
Could I comment?
Hit me with the, wait, I didn't hear you address the regressivity issue. Could you take another crack at that, please?
Yeah, absolutely. You know, I think that in terms of the regressivity, folks of all demographics utilize tobacco and other products that are taxed as well. And so folks having access to it, it's not going to be any huge difference in terms of the usage for the communities actually wanting to get a hold of it. You know, we're wanting to make sure that folks, you know, we're curbing this issue and thinking upstream. So we understand that it could be a burden to some, but we're really thinking about a healthier solution, and this is that vehicle.
And I would just quickly add, Elisabeth Shepard, campaign manager for Yes on 108. We know that over 70% of smokers actually want to quit, have a desire to quit. And what Measure 108 does is nearly triple the funding for smoking prevention and cessation programs.
So the no side has made the public health argument that I think we've all read, that switching people to vapes is preferable to having them continue using tobacco in whatever form. I'd like the yes side to address that argument. Could you respond? I mean, I think they've made the case that vaping is the healthy solution. I'm paraphrasing and using my words, not theirs, is the healthy solution to nicotine or tobacco addiction. So please address that argument.
So I think what's important to note is that electronic cigarettes are not approved smoking cessation devices by the FDA. They go through quality control. There are many FDA approved smoking cessation devices that actually help people quit their nicotine addiction. And e-cigarette users, the data that we have shows that they are still using electronic cigarettes instead of actually quitting nicotine, which is the preferred option for people who are smoking, to work with their doctor and really stop smoking completely. And also to prevent, I'm sorry, I have so much to unpack from the comments here that I'm getting flustered. I think that an important part around the harm reduction is that we don't know. There are no long-term studies around whether or not this is healthier. There's one study that they're commenting on from the Royal College of Physicians, but there's not long-term studies. And that one is from the United Kingdom, which our own doctors here have said that this is not comparable. It's apples and oranges because of the way we regulate tobacco products in the United States is not similar to how it is done in Europe. So that the study that is often brought up around harm reduction is not, we don't know if it's the truth or not. And the best way to make sure people actually quit is to use an FDA approved cessation device to do so. And as Stephanie mentioned in the comments, they often become dual users.
What you're seeing there, respectfully, is ideology over public health, because it's not just the UK Royal College of Physicians. Former FDA Commissioner Scott Gottlieb, an anti-tobacco warrior, stated before Congress that if every smoker switched to lower risk nicotine products like vaping, there would be a tremendous public health benefit. And even you may want to speak to scientists at the C3 American Heart Association, because they have put out statements saying that the evidence points to great harm reduction benefits, sending messages to smokers that, hey, if you're vaping. If you switched over to vaping, well, who knows? It could be just as bad as smoking. So you might as well not even get off cigarettes if you're still going to use nicotine. That's a dangerous message to send. And in Oregon, the bulk of adult smokers are lower income. 30% of those that did not graduate high school in Oregon, for instance, are smokers. So it is regressive to go after these people. It's one thing to say that with something as deadly as cigarette smoking, you're justified in raising a tax because in the end, you're doing good. But when the evidence from the National Bureau of Economic Research, a very well-respected economics org, they looked at the data from Minnesota where they raised their vaping tax while neighboring states did not. What they found was that if you had the same tax, the same attempt to make taxes on vaping products equivalent to cigarettes in every state in the nation, that would result in 8% more smoking. So when you raise the tax on vaping products, you'll have more smoking in the state of Oregon than you would in a state like Idaho, which is not going to have a vaping product tax. So I understand that the people at the Yes Committee, their job is to push this, but they're just ignoring harm reduction because they know that they can't. It's difficult to justify putting equivalent taxes on products that are so radically different.
So a question
I'd like to, can I respond briefly just to that, since there was a misinformation in that line. We do not have a C, but we are all a C3. The American Heart Association is one organization. And in fact, our policy position remains and will continue to be until evidence shows us and science shows us differently, is for all smokers to work with their doctors to stop smoking and prioritize evidence-based FDA cessation devices, of which e-cigarettes are not. And whether cessation aside, we have a youth vaping epidemic because these products are too cheap and our children can get too much access to them. And that is what the root of this is really trying to get at. The other statistic that you brought up was the recent reduction that's shown from the FDA. 1 in 5 high school students is still smoking. It's still an epidemic. Yes, it may have gotten better from the very bottom of how terrible it was. This still continues to be a problem, as Bianca has mentioned.
A question that I have that perhaps will help shift this a little, or at least clarify some things for me, is how much do the prices increase? In other words, my understanding is that cigarettes would go up by $2 a pack. Is that right?
I could take that. So for an example,
what other increases
I'm sorry.
are you going to see? So I'm trying to understand, like, let's say I'm vaping, what am I going to pay?
Right. So if you were to come into my shop, I could say, and it's true, the average cost of a setup for what we sell our customers is $100. So you add 65% to that, that means for me to make that up, I then have to charge $165. Now that same product goes online for $60. So there comes the problem where that kind of shuts most of us out of business who can't survive that kind of tax. And I'd also like to point out with what was said, that vaping is proven to be twice as successful as those quit smoking methods that everyone seems to think should be the only route that we could go. So, and then one more thing, if you don't mind, we haven't really been given a chance to go all the way through the FDA process. I actually do manufacture e-liquid, and I am currently going through that process, and my application was just accepted to move forward through the process. So if I'm put out of business, then I'm not even getting a fair shake to show that my products are what we say they are. So
for the sake of continuing this conversation in a way that's productive for our editorial team, let's just assume that the two of you on these two sides disagree on the FDA thing and move on from that point.
Sure.
I think it's stipulated at this point that you're not going to reach an agreement on whether or not vaping helps you quit smoking, nor do I frankly care. So I'd like to keep moving to other topics. Nigel, what's your next topic?
I just want to, Greg, briefly ask you, so you made a strong case for why this 65% tax increase is too much, but a tax of zero is kind of unrealistic. And I mean, the industry has been living in a dream world in this state for its entire existence. So if 0.65 is too much, what's a fair tax? What would your industry actually see as a fair level of taxation?
Sure. So what happened in states like New Mexico, Connecticut, and New Jersey was that they looked at the products that were on the market. They looked at what products were the problem. The problem has been the last 2-3 years, these closed system, small products like Juul. that they are very concealable, and they are the products that are being used quite frequently by youth. And so what they did in New Mexico, Connecticut, and New Jersey was that the more tobacco style taxation of $1 a pod or 50 cents per pod, they put on the Juul product. Meanwhile, for the e-liquids, the open systems, the ones that are refilled with liquid that Jason sells in his shop, they put lower taxes like 12%, 15% of wholesale. And in those states, even after those taxes, there's no evidence that because of those taxes, all of a sudden the youth have switched to the lower tax product. So there is a way to do this fairly, but to do it fairly requires actually looking at the data and saying, okay, this class of products is clearly a problem with use, while this class of products, you have 4 or 5 times less youth usage.
Okay. I want to ask the proponents, we haven't touched on cigars, and maybe cigars are a tiny fraction of the tobacco market, but that's a big increase. Could you explain it? I mean, they're all big increases, but explain the thinking behind the cigar increase, please.
So really, it's very simple. The category of other tobacco products is already currently taxed at 65% of wholesale. So what this does is put all nicotine tobacco products on the same playing field of 65% of wholesale. The cigar cap tax is increased because currently it's 65% of wholesale or 50 cents. And all this is doing is simply making it $1 if the 65% of wholesale becomes more than $1, it is capped at $1. So even for premium cigars, right now, if you're buying a $65 cigar, the tax on that is capped at 50 cents. And what this is proposing is to simply raise that to $1.
If only we could have a cap.
All right. I'd like to ask, this is a big and complex issue, and we've asked a few questions. We could go on forever asking additional questions, but I'd like to give each side a chance to introduce any new information that hasn't been brought up. Please do so very briefly, and we'll have maybe a couple questions after that. So pro side, what hasn't been brought up that you would like us to know?
I think one important part of something that hasn't been brought up is the cost of smoking in Oregon. The smoking in Oregon costs the state $1.5 billion annually. That is partly healthcare. It is $350 million for Medicaid alone and costs directly related to smoking. And that is an important part of kind of the cost of society. It's a burden for all Oregonians, whether they're choosing to smoke or not.
Okay, and for the no side, what haven't we heard from you that we should be thinking about?
Jason?
Well, I'd just like to point out that I know you're trying to equal the board, but we are not big tobacco. Vaping is not big tobacco. Big misconception there. Small business owners, big corporations, so different levels of playing field there. And that, you know, we don't condone youth use, and we just want to continue to help our adult customers. So.
Okay, great. All right, Aaron, do you have any further questions? May have lost my colleague.
Sorry, I've had a bit of connection difficulty. I wouldn't mind if the yes side could give us one more iteration of where this money is going to be spent a little bit more specifically. Maybe I am gone. It's quite possible.
Aaron, your face is frozen. I can see Christina is ready to unleash some knowledge on us. Go ahead, Christina.
So the allocation for the new revenue, 90% of the new revenue will be going to the Oregon Health Plan, Oregon's Medicaid program, of which 1 in 4 Oregonians is currently receiving their health insurance from, including 400,000 Oregon children. And the other 10% is going to tobacco prevention and cessation programs. Currently, we fund that program. This will more than triple that program, making it around 50% of the CDC recommended levels of funding for tobacco prevention and education in the state of Oregon.
When was the last time that Oregon increased tobacco taxes?
The last time we had a meaningful increase in tobacco tax was nearly 2 decades ago. And what I mean by meaningful is enough that industry tactics doesn't actually negate the cost of on the consumer for that feeling the increase of the price. Oregon also holds the unfortunate unfortunate winner of the fact that we have in fact decreased our tobacco tax once in the past couple decades. So yeah, it was last done in 2002, and then there's been a couple pennies here and there, but this is the first significant increase in quite some time.
Is there going to be any kind of change in the border economy on this? Are tobacco prices in Idaho all of a sudden going to be a real bargain for somebody living in, say, Ontario?
So this actually puts us right in line with the taxes in both Washington and California, where most of our population would be potentially crossing the border. Idaho is a bit of a different story, but this puts us in very good alignment with the rest of the West Coast states.
For the record, I think in total, the Idaho cigarette tax is about 87 cents per pack, and there is no corresponding tax on vaping products.
So you would argue that this is going to create quite a border rush for the state of Idaho on both tobacco and vaping products, Gregory.
Of course, we saw in Kansas a couple of years ago, you had them rush through during a budget process a 20-cent per milliliter tax on vaping products, which they sell bottles 30, 60 milliliters. So 20 cents times that is your new tax, $6 or so. And you had stores over the Oklahoma border coming to vape shop parking lots and putting flyers on people's windows saying, save $6, come over the border. That will end up happening to shops along the border. There are many great, very good vape shops in Idaho. They've allowed that industry to be built there. So there's absolutely going to be not just an increase in internet sales, not just gray market where people get friends to ship them things, but you're also going to see some cross-border activity.
I'm not sure where those anecdotes are coming from, but our data tells us is that we do not really see a rise in black markets from other states that have passed similar measures. And I also want to address a fallacy that I heard earlier on related to online sales. This will absolutely apply to online sales. And I'm sorry, what was your name? Was it Jason? I see Elisabeth Shepard there.
Jason. Yes,
yeah, so you still will be competing with online sales to the same extent that you currently would. I just want to point that out.
May I ask how that gets enforced?
Online sales does not actually mean that it will be enforced. There are many states that have put restrictions or taxes that should apply to online sales, but unless an attorney general feels like budgeting 500 grand to go after 25 different sellers across the internet, that's not going to actually change anything. Well, and there actually are no studies, just to point out, there are no studies saying that there is not black and gray market activity in response to taxes on vaping products.
Well, at the risk of taking the yes team's argument for them,
please.
I don't understand how it is that we're supposed to tax anything without the risk of a black market online. I can buy cigarettes online from a black market, and the state of Oregon probably won't be able to find them because the internet is evil.
What is different about cigarettes is that there is a federal law with real federal penalties for selling untaxed cigarettes on the internet. There is no corresponding federal law that covers vaping products. So there is no fear from somebody in Idaho or North Dakota that the Attorney General of Maine or Oregon is going to come after them for untaxed sales. The worst that ever happens in 99 out of 100 of these cases is a warning letter. And meanwhile, they've made 5-6 figures and they close down the site and move to the next one. That's the difference with cigarettes and alternatives.
Well, I mean, even if there were this black market that it sounds like is either happening online or via flyers on cars, I'm not sure which one you're arguing there. When you increase the cost, which is the objective of the measure, use goes down. And if there were an imaginary black market, it would still be increasing the cost in that environment. So you're just going to see a reduction in use, particularly among youth, because they're the most cost sensitive, as Bianca pointed out earlier.
To be fair, I don't think the flyers are about the black market. I think that's about a border economy issue, about whether or not another state with lower taxes would then advertise in, say, Ontario, Oregon, or Hermiston, Oregon, that they should go across.
You're cutting out a little bit.
Yeah. Aaron, you're cutting out. I think, yeah, we could argue this border issue all day. I mean, we've actually seen a lot of evidence in the liquor market when Washington decontrolled its liquor prices. So I think we're going to end it here. I have one factual question, Christine. You and I have communicated before. I think you probably have my email. If you have that breakdown of where you think, where the revenue is coming from, I'm sure there was a study that was done. I'd love to know how much of it is tobacco and how much of it is vaping products. I want to thank you all for taking the time. I wish we had more. We have had so many of these things today that we are out of time. So thanks all very much.
No problem.
Thank
Thank
you.
you.
Thank you.
Have a good night, everyone.